Okay, mitral stenosis. They love testing about mitral stenosis. So almost always related to rheumatic heart disease. That's why we don't see it very much anymore. But you'll still see it in patients who grew up in developing countries where antibiotics are not as prevalent and their strep throat may have gone untreated. It will often present with AFib and embolic events. That's an important concept. Have you guys heard of valvular AFib? When they talk about valvular AFib, they're talking about AFib in a patient with mitral stenosis. They're not talking about AFib in a patient with AS or with MR. It's mitral stenosis. And the reason that it commands its own category and term is because, for whatever reason, they are incredibly prone to clots forming and getting strokes and embolic events. So they can present that way. I saw a case a couple years ago of a 20-something-year-old woman who grew up in Mexico and came here, and she initially presented with TIA-like symptoms, went to the ED, sent her home, and then she came back the next day with severe flank pain and had an embolic event to the renal artery. And a bunch of other things happened. And she eventually, the diagnosis was made by echo, which is sad because all you had to do was listen right here, and you would have heard this beautiful rumbling diastolic murmur with an opening snap that was classic for mitral stenosis. And she perhaps wouldn't have lost her kidney, and she underwent a bunch of other tests, including bronchoscopy when she presented with hemoptysis, because they will often present with hemoptysis. So she developed hemoptysis and had bronchoscopy and had CTs and all this stuff. And all of that comes at a cost. Not only monetary, but as repercussions for the patient. That's extra radiation for patients. Sometimes we do extra tests, or we just think, oh, let's just test them for all this stuff. Well, you should never think that way, because if you take 100 people off the street and you just test them, you run the same test on 100 people, some of them are bound to come back with positives. And then you're going to go down this rabbit hole, and more tests, tests beget more tests, and then they get a complication, and they end up on a ventilator, and it's bad news. Yes. Correct, right after S2. So the way it sounds is, so I'm going to do the murmur in diastole, and then it's going to run up into S1, and then you're going to hear the opening snap and the murmur again. So it's whoop, but up, whoop, but up, whoop, but up, whoop, but up. So the whoop is the murmur, and it gets louder right before S1. So whoop, S1, but up is S2, opening snap, murmur. So whoop, systole is quiet, but up, whoop, but up, whoop, but up, whoop, but up. Yeah, no problem. We actually, that same case, we presented, or we published with an audio and video, and you can, if you just Google my name and mitral stenosis, you'll find that video, and you can listen to it. The murmur is absolutely classic, has an opening snap. There's actually a phonocardiographic tracing. I bought a 1958 so you guys know what phonocardiography is? So this stuff here, these are phonocardiograms. So they're graphical representations of sounds of heart murmurs, and that's what they used to do before echo. Is they used to take a phonocardiograph machine and record these patients' hearts. And I think it's great for teaching purposes. So I bought one, a 1958 Burdick machine. It was awesome. One Saturday night, I got the phonocardiograph, and I took it apart, and I opened the thing up, and it smelled like 1958. It was just crazy, like it had never been opened before. And so I'm looking at it, and I'm like, okay, so here's the box, here's the microphone that you use to record, but where do you get the readout? So I open up the instruction manual, and it turns out that it's an EKG machine that spits out the sound. That creates the printout. I'm like, oh man, I'm looking at the cord that connects to the EKG machine. It's like this big. There's no way that there's an EKG machine that this will hook up to now. So I said, okay, what can I do? So I bought an EKG machine from 1950, whatever. And so I've got these two, machines in my house, and they look like they could kill somebody if you didn't use them right. And so it was one Saturday night. I got everything. Oh, the other thing was that the battery that the phonocardiograph machine came with was this big mercury battery that they don't make anymore. And I mean, it came with the original battery, and so obviously it was dead. And so that was the other piece. And so I talked to a bunch of people, and I figured out that there's some equivalent alkaline battery or whatever. So I went and I got that. So I had all these pieces that like in front of me, but I had no idea if they worked or not. By the way, the guy who sold me the phonocardiograph machine said he's not a doctor. He's not in medicine. He has no idea if this works. He just collects antique medical equipment. So good luck. So I was pretty confident though, because it looked like it had not been opened. Or used very much. And then, so I hooked it all up. I made the sign of the cross, went with it, and I recorded my heartbeat with it. It worked. It was awesome. And so since then, that was probably, 4 years ago or so. So since then, I've been using it to kind of record patients who have gallops, because sometimes it's hard to hear, is this an S3 or an S4? Where's this murmur in systole or diastole? So it's really nice for learners to be able to see they're getting both inputs, visual and auditory. So anyway, why did I start talking about that? Oh, so yeah, if you want to look that up, so we recorded it. We recorded the murmur with the phonocardiograph machine, and we had this student who was really good with computers, and he basically, so the phono strip is, you can see it, like maybe there's 6 or 7 beats, so you see the murmur and stuff, and then he had this cursor, and he overlaid the audio with it, so the cursor is going across the phono as, in a video format, so you're hearing the murmur as you're seeing it. So if you guys want to know what mitral stenosis sounds like, Google that. Google mitral stenosis plus my last name, and you'll come up with that publication. You'll be able to hear that murmur and see it. Okay, so the exam, low-pitched, rumbling, decrescendo, crescendo, diastolic murmur heard over the apex in the lateral decubitous position. Think mitral stenosis, loud S1, and an opening snap. You might also see LA enlargement, RVH, in patients with pulmonary hypertension. By the way, that's why they get hemoptysis, is because of the pulmonary hypertension that they develop. Management is sort of twofold. So as we talked about, AFib is a big deal in patients with mitral stenosis. They're really high risk for stroke and other embolic events, so you really want to anticoagulate them, period. And then the other piece is the valve disease itself. If they're symptomatic and severe, valvotomy, where they basically just kind of open up the valve, they'll create regurg doing that, but they'll at least relieve the stenosis, or they'll do a replacement. And then in asymptomatic patients, serial echo.